If you are about to lose all your top teeth, then you're going to have a couple options. So generally speaking, the reason most people lose their top teeth is one of two reasons. Either they've lost all the bone that holds their teeth in their mouth, or they've lost so many teeth over the years and the rest of the teeth aren't really strong enough that the rest of the teeth have to be extracted. And they're looking for something to put in there. So traditionally in the past, there's only really one option. It was a denture. This is what a denture looks like. It's got false teeth. It's got acrylic all through the palate, and what happens when we take out the teeth, we put in the denture, and most people would have to live with it. And a denture, you know, some people can function okay with a denture, some people can't. The challenges most people have would be the extension of the denture. It's got to go way in the back of the mouth, past the hard palate, and rest even on the soft palate. And the way the top denture works is you put it in, you swallow, and it creates a seal. You need the back end of the denture. Without this, there would be no seal. If you were to cut it forward, there would be no seal and it would get pretty loose. So the challenges people have, people sometimes tend to gag with the top denture on because it goes so far back. Some people can't taste their food. Some people lose a lot of the sensations of eating and overall just don't like it. So for people who are losing their top teeth and going from teeth to the possibility or very real possibility of having a top denture, they want to know more about using implants to support them. And there's really kind of two different ways we use implants when we're losing all the top teeth. One way is to place implants in the top. Generally, you're looking around 4 to 5 implants and maybe more, up to 6 implants on the top. You can place them 1, 2, 3, 4, 5, 6, and then creating a denture with little holes in it that snap into the implants, so they engage in the implants. And when you have about 6 implants, you can actually cut the palate of the denture and have a palateless denture that engages in those implants, and it sits really well and really strong. Now, the other way of using a denture or using implants to support a denture is to actually place implants, punch holes in the denture and screw it right into the implants. I'm going to show you what I'm talking about. So one of the options we had discussed was if we have a denture and we have implants. So if you have implants there, they have little locators on them, and we have holes in the bottom of the denture, and then we basically snap the denture into the implants, and that comes off and on just like that, but with a lot of retention and makes them fit really good. You do that on the top, and on the top, if you put enough of them in, you can cut the palate off and have no palate. But if you put, you know, about 2 or 4 of them in, then you're still going to have a full denture that looks like this. Now, if you go to an advanced design, which is called all-on-4, or a denture that screws into the implants, as you can see, you can place 4 implants. This is a top denture with no palate with holes in it. We actually screw the denture right into the implants. It doesn't come off and on. There is no palate, and it works extremely well, especially for people who are going from teeth to no teeth. And these are people that aren't used to having a denture. These options are significantly better than having just a denture. With one other added bonus that isn't explained all the time. Generally, when you take out your top teeth, your bone starts to shrink over time. And in the first year, you can actually lose up to 40% of the bone in the first year alone. And as the bone shrinks, your top denture starts to get loose and you have to make it all the time, and it doesn't fit as good. One of the benefits of having dental implants is when you take out your teeth and you place dental implants, everywhere there's a dental implant, the bone doesn't shrink. So you manage to keep a lot of bone, and it keeps your face strong and looking young, so it doesn't shrink up and age prematurely. So in this video, I explained to you how we can use dental implants when you're losing all your top teeth.